Cancer, like if you consider cancer versus non-cancerous cells, um, non-cancerous cells are healthy cells, have an ability to respect the boundaries of the cell wall, like they respect the neighborhood, you could say. So when there's a cell in a healthy neighborhood of cells in your eye or your arm or wherever, or in your organs, um, and it's starting to grow too large, then there are sensors that inside that cell that it can feel the pressure of the sensors surrounding it, and then it will use feedback to either fix itself or to even kill itself. So it has, because cells are replacing themselves all the time. We think that we're the same all the time, but many of our cells replace themselves within months, depending on which cell type it is, the liver, the bones, etc. It's anywhere from weeks to, I think 7 months might be bone cells. So each of the cells are constantly replacing themselves. So that means they have programs and instructions to make the cells die off so that new cells can replace them. But that living healthy cell has the capacity to communicate with the neighboring cells around it and coordinate.
Mm.
Where it's a malignant cell, and it also has a very efficient form of feeding itself. And so that means it can get fuel and build proteins and repair different cell surface areas and different organelles, parts of the cell that do different work. It can do all that work and is efficient in deriving glucose and other nutrients to feed the cell. So again, we're assuming a healthy cell.
Mhm.
So when you take a cancer cell, that cancer cell no longer communicates successfully with surrounding cells. So that's one characteristic that's unique. So in other words, if you have a healthy colony of cells versus a cancerous colony of cells, that cancerous colony of cells can now start growing unregulated over top of and in between healthy cells and inserting itself because it's ignoring or it's lost the capacity to hear the signaling of the normal healthy cells around it, which is what scares us about cancer, is because it can grow at such an incredible rate, or even just a slow rate,
Yeah.
but it can overcome many of its neighboring cells and cause damage to the liver or the pancreas or the lung, in such a way that, now the patient has problems breathing or their liver function starts to decline. So that's one aspect. The other aspect is because a cancer cell uses a metabolic process that's very inefficient, it can consume huge amounts of energy that the whole system needs to survive, and therefore cause the patient to become very weak and drained. This is more towards the end stage of cancer when the cancer is really taken over.
Mhm.
But metabolically, because all of those cancer cells are so inefficient, they're just draining the life force out of that patient, and that can put that patient in end stage cancer into a state called cachexia, which is a form of malnutrition where the patient completely loses their appetite at the same time that they're losing skeletal mass and they're becoming profoundly weakened. So cancer has, I mean, these are very crude estimations of the difference between a malignant cell and a non-cancerous cell, but
Mhm.
this gives you some kind of broad ideas. And the other challenge with cancer is it can be growing inside someone, and this is not uncommon. It's an insidious process where someone can be slowly having a cancer of the colon, for instance, and not know it until the
Wow.
cancer is so large that they have some constipation or diarrhea, and they're lucky enough to see a doctor who orders a test, and the test shows, oh my God, something really weird. Then they do imaging and they see this huge mass. So that's
Wow.
the other scary thing about cancer, is besides its insidious nature that it can be building up, is that it can rapidly take your life. It gives you kind of a basic distinction between non-cancerous cells and cancerous cells.